With over 45 years of clinical and industry experience,
it was not the extension of a suction. It wasn't passing things to a dentist. Yes, it was part of the job, but to me is seeing the end result of the patient and seeing the wow at the end of that treatment. And I'm going to get emotional. She starts to cry. Do you want us to take it away? No, she says, this is the happiest day of my life. We were able to do for patients. I was like, okay, this is what I want to do.
Vavi Bovart's extensive background spans every aspect of the dental practice. Retiring soon from corporate dentistry as a senior director of key accounts, Vavi's new passion in the second stage of her career is going to be dedicated towards providing world-class implant education while empowering dental professionals to elevate their skills, confidence, and success, one patient conversion at a time. With that said, you're tuned into the EG Dominates podcast, coming to you today from home base, Winter Garden, Florida. And today my guest is none other than the very talented Vavi Bovart. Thank you so much for being on the show.
Thank you. It's an honor to be here, Eric.
Well, it worked out well because you were in town for a big dental meeting.
Yes.
And you're kind of winding down towards the end of your corporate career. And with the amount of experience and stories that you have, I think that anybody that's in the dental industry, especially if you're a dental assistant or you're thinking about becoming a dental assistant, this would be a really powerful episode for you to watch and to learn from Vavi. So I'm really excited to hear about you as a person, your background, your past, your passions, and where you see yourself going in the future.
Thank you. Thank you. Thank you for having me here and, inviting me into your home and having this interview. It's really an honor.
Absolutely. So, Vavi, take us back for everybody that's watching the show. You've been in the dental industry for 45 years, which is absolutely insane, right? That's incredible. Tell the folks that are watching the show, where did you grow up? What's your background?
Yep. So I grew up in Montreal, in Canada. Didn't know where to go with my life career-wise at a young age. And there was a dental assisting career program that was given in Montreal. And I was thinking about it and wasn't sure. I had a cousin that was a dentist. And I said, let me spend a couple of weeks with you and see if that's what I liked. And first day, I was like, yep, that's what I'm doing. And went into the career course. And then first day on the field, it's interesting because it's interesting how life brings you right back to where you started. And first day of my career, I was working for a prosthodontist that was placing implants. First day as a dental assistant out there, and it's full flap. Back in the 80s, it's 1980. Full flap, patient coming in from New York City, and I felt faint. I was like, I can't do this. This is not going to be good for me. And I had to leave the room. And I said, okay, no. You like this career. You got to make it happen. Had a little bit of OJ, went right back to the room, and the rest is history. Loved being a dental assistant, loved the career. And as gross as this may sound, the more blood, the happier I was. So a lot of surgery. I did work for an endodontist, which was okay. But when he did apicolectomies, I was a happy camper. So the more blood, the happier I was.
So why dental though? Like what was like the connection that sparked you to start this whole thing from the beginning?
The field, I loved the field itself. It's helping patients. I went through a lot of dental issues in my youth. I used to stupidly, I don't know why, but I was used to suck on lemons. That was something that I liked when I was younger, weird enough. Brushing teeth and oral health was not something that I was taught when I was younger. And so I suffered a lot with my teeth. And when I saw what we were able to do for patients, I was like, okay, this is what I want to do. I want to make patients have a better smile, feel better about themselves. And so for the rest of that career that lasted 16 years, I worked on my way to convincing patients to go in the right direction as much as I could.
Okay.
Yeah.
So what does that mean? Like, what does that look like or sound like? If I'm somebody that is not in the dental industry and I'm watching this, like what exactly do you mean by that?
Well, somebody that comes in that, with their hands on their face, and I would notice patients that would have upper and lower dentures. And when we would take off their dentures, it was always their hands on their mouth. It was like as if we would strip them naked in front of us. And it's, for some reason, I always had a good feeling about these patients. There was something that I didn't ignore it. I would face it with the patients and I would say, okay, what's going on? We took off your denture. I saw your hand on your mouth. What's going on? And they would talk to me. And so you develop this relationship with patients that make you have the kind of right to guide them in the right direction. And even, in the 90s or early 2000, we talked about implants. Implants were starting to get more and more accessible to not only specialists, but GPs. And so giving them the direction of, let's do this. Let's not have your hand on your mouth. Let's make you feel better about yourself. And that became what dentistry was for me. It was not the extension of a suction. It wasn't passing things to a dentist. Yes, it was part of the job, but to me is seeing the end result of the patient and seeing the wow at the end of that treatment.
That wow factor.
That was huge.
Yeah.
Huge for me.
That emotional reveal is something that up until like what happened to me,
Yes.
I'd always think of like, okay, cool. Like, you got, an implanted denture or whatever the case is, and you see yourself in the mirror and you're like, oh, it's hard to put an emotional aspect to that unless you're going through that yourself. And then after going through something like that myself, even like today, when I'm in offices and I see patients that have had that reconstruction, that restorative work done, and they have that new function, stability, quality of life,
Yeah.
the way that it makes them feel, the emotional, people are crying. Like, you're changing their quality of It's so impactful.
Yep. I have a good story for you. That was while I was working in this organization. And I was in the beginning of my career. And the way I learned is I followed cases from beginning to end. So from the day they said yes to a case, all the way to the delivery date, to the lab, to everything, to all the phases. And that's how I learned the steps of what we did. And so this case, this patient was in her 60s, and she had lost her teeth at the age of 17. She had an upper and lower denture, which is not a rare thing in Montreal, Quebec area back in the days. And she decided to trust the dentist that she was at, and she wanted to do a fixed prosthesis, upper and lower. And so moving forward, we're almost to the point where we're going to deliver the case. And the dentist calls me and says, it's my first big case. I'd like to not only, say thank you to the patient and reward her with, a beautiful end, but also say thank you to the team of, what we've gone through together to learn and, deliver this case for this patient. I says, a bubbly would be fun. It's too bubbly. And I didn't say champagne. I said bubbly, but he went all out. He bought champagne and could have been just bubbly. And we're all in the room. Case is delivered. She hasn't seen herself in the mirror yet. Nothing. And we give her a glass of champagne and we wait for her to take her first sip. And I'm going to get emotional. And she starts to cry. And we're all looking at each other and we said, oh, crap, is it something that we gave her that brings her a sad moment in her life? Or is it something that, that just reminds her of something that's more sad than happy? So we kind of stopped and said, do you want us to take it away? No, she says, this is the happiest day of my life.
Happiest day of my life.
Okay, talk to us. What made that bubble or that moment make you cry and get so emotional? And she looked at us and she said, I haven't felt bubbles in my palate over 35 years. And we all looked at her and said, huh. And in my head, I said, yeah, I'm in implant dentistry for apple, corn, steak, salad. That's what we think. And all that made her happy was the sensation of the bubble in her palate, which we take so for granted.
Mm-hmm.
And that made me realize that day, and I said, okay, this is what I'm here for.
Yeah, that's powerful.
It's huge.
Mm-hmm.
Huge.
And so when did you have that aha moment? When was that for you?
It was
How many years into being a dental assistant was it?
I was actually working in the corporate. I was
Okay.
working for the medical device. So that was 5 years in. 5 years in was I already knew what I was doing and I was already passionate about it. But that moment took me to another level.
Wow.
Yeah.
Wow. So I think about everything that you have been able to experience, accomplish, help people with. You were instrumental in helping to train me when it came to implants and biologics a couple of years ago. And I know you're wearing for a long time wearing multiple hats, doing lots of different things. You have connections within this industry that span across the globe, and you have relationships with a lot of what people would consider some of the founding fathers of implant dentistry in the United States. Why don't you talk to us a little bit about how you developed relationships with some of these folks, who they are, and what you learned from them over the years?
Thank you. Yeah, it's a beautiful opportunity you're giving me to thank a lot of people. And I know I'm going to forget some people on the way. The first one that I was exposed to was Dr. Carl Misch. Unfortunately, he's not with us anymore. Went to his class in Toronto, and there were 100 dentists in front of me. And I was in the back of the room quietly trying to learn about implant dentistry because I just started this career. And I'm writing notes frantically. and it was paper, right? And back in the day, it was 2002. So paper and pen. And I can't keep up. There's so much information. And Sunday morning, I remember there were still these 100 dentists in front of me. And I'm thinking, if me, after 16 or 17 years being in this career, and I can't stop writing notes, where are all the assistants? What are they learning? And how are they learning what I just learned in 3 days? So that was my first exposure of going back home and saying, all right, from now on, whatever I learn is going to be transferred to some kind of education for all levels of auxiliaries. So whether it's front desk, whether it's assistants, hygienist, coordinator, whatever it is, it's going to be transferred. I'm their transferred education from these courses. And I was blessed to continue going to Dr. Carl Misch's class. He used to do 5 classes a year, 4 to 5, depending on the year. And for 13 years in a row, I was in his class in the back, kept on learning. I was blessed with Dr. Picos, which I know you've known. I was blessed with Dr. Pat Allen, soft tissue, suturing. I became a little bit of the suture queen because I love, I was very, just sitting with Dr. Pat Allen and getting all the information from him on meticulous, right? How to pass on the information. Dr. Natalie Wong, who's in Canada, who actually initiated me in giving courses for auxiliaries at the Misch Institute back in the days. I was also, so we call it the French Misch, which is Dr. Yvan Poitras, who's in Quebec, in Quebec City, who used to take Dr. Carl Misch's with permission, Dr. Carl Misch's class in English and would give it in French in Quebec. So I was there also 5 times a year for over 15 years in my life. So, my God, who else? Dr. Moody, Dr. Steigman. It just keeps going. Dr. McCracken. I mean, I could just keep going. Yeah.
Quote unquote legends in the dental industry.
Yeah.
Right?
Yeah.
You've learned a lot. How did that help you kind of advance your career? So I'm thinking like this, right? If I'm sitting at home or I'm watching this episode somewhere and I'm a dental assistant and I've been a dental assistant for a couple of years and I want to level up. I want to level up. Maybe I want to get better clinically, or maybe I'm looking to expand on my personal value or worth within the practice I'm working for. Speak to some of those things, and somebody that might be watching that is either looking to advance, or maybe they've been a dental assistant for a while and they're getting burned out. What would you
Yeah.
say to those folks?
I'm going to say what helped me from day one being a dental assistant is staying curious. I was always curious. I was always pushing. I was always wanting to know more. How do I do this? How do I do that? Because at the end of the day, your dentist, you do want to grow, hopefully, in your career, or you want to raise. Let's keep it as simple as I want to raise. And I remember my dentist would say, well, why would I give you a raise? What did you do to deserve that raise? And I'd have to think about it. That taught me how to be curious and grow in my career to demand that raise that I deserve, right? We don't just deserve it for nothing. So keeping me curious kept me going, kept me evolve, and kept me interested and not get bored or burned out in the career, like you say. As a dental assistant, if I didn't go that trajectory and I would say, let's say, a dental assistant or an implant coordinator would have been probably something that I would have still done till today. Invest in your career. Go take courses. Go to the ICOI. Go to the AID. Go to the ADIA. Go take it. There's auxiliary courses meant for auxiliaries that are there to help you grow in your career. Get the information that you need to be able to become more powerful and a better leader in your office or in your career, to be able to just grow. And if assisting is what makes you happy every day, which it did for me for a long time, that's fine. Stay as an assistant, but grow in that career. Make it that it's not a punch in, punch out every day. Make it so that you wake up and you're happy with what you're doing, and that you're giving back to not only your team, but to the patients. Because at the end of the day, that's what's important, is that we deliver the right treatment to all the patients that we have.
I've always found it very gratifying to work with dental assistants and hygienists, especially around having conversations with patients and being able to quickly and effectively educate them chairside using the visuals on your 3D scanner. And it's always so gratifying. I'm going to use that word again, but it's a gratifying experience to sit there and to see an assistant have a successful conversation with a patient, and to have that patient look at them fully engaged in that conversation and understand what it is that assistant is trying to educate them or convey to them. So using not only verbal communication, but also using the visuals in front of them to illustrate the point that they're trying to make.
Well, it's interesting that you say that, because if I go back to being a dental assistant, young dental assistant, beginning of the career, and my dentist would go and take these amazing courses. And Carl Misch was already teaching at the time. So going to get these amazing courses, and they would come back with all their toys and all their, silver little shiny things that they bought in the course. And now they want to put it into function. Remember, I wasn't educated, right? I didn't go to that course. And as an assistant, I remember saying in my head, 2 weeks, they'll go back to normal. We'll be fine. We'll just go back to our new schedule. And a lot of assistants are thinking that way, because new toys is new learning. It takes more time. Oh, now it's going to take, going to leave late now. And it's just takes a lot out of putting a new system into the office. Well, if I just look at implants, which is my field, implant dentistry is not here to go. Implant dentistry is here to grow, right? So we as assistants, or auxiliaries in general, need to learn to be able to move in the same path as the dentists want to go. But we need to be educated.
Yeah, that's spot on.
Yeah.
I think of a story that you had told me a couple of years ago, and I know it's a good story because I remember it, right? I want you to tell the story if you can right now. But when I was going through training and I was in one of your courses, one of the things that you had discussed was when you're talking with a patient and you're trying to educate and convey to them the difference between getting I think it was like a bridge versus an implant bridge.
Or partial and a implants or dentures and implants. Yep.
You kind of walked us through, some really cool educational touch points that dental assistants can kind of use in order to convey that message to the patient, but also to set the doctor up for success. When somebody's in the chair, they shouldn't be hearing something for the first time when the doctor comes in. A lot of times the hygienist or the assistant, depending on where they're sitting in the office, they're the first line of defense. They're the ones that are going to establish and to build rapport with that patient. They're the ones that are taking care of a lot of the important things that need to be done on the front end and the back end.
Yep.
And when a dental assistant or a hygienist conveys a message to a patient and the doctor basically reiterates that same message, now they're hearing it from two different vantage points of two different people without practice. It holds a lot more weight. So walk us through this story because it's so good. I remember going to offices with denture paste. You had me taking denture paste and dabbing it on people's fingers and they're putting it in their mouth. Oh, Eric, what are you doing? Walk us through this.
Yep. So the first thing that we have to be aware of is let's stop talking to our patients. Let's start talking to people. It's people in front of us. It's not a patient. Yes, we put a bib on them. Yes, we put our mask on us. But before we start doing all that, let's chit chat. It's called a chit chat with your patient, with the person in front of you, which is obviously your patient. Where it starts is when you walk in through the door. When you put the hand on the door handle, any auxiliary, any dentist, leave behind what goes on at home. Leave behind what goes on in your personal life. And start your day focusing on your patients. And I always tell the auxiliaries, if you focused really well on what the patient is telling you all day long, by the end of the day, you should have a migraine. In a funny way, right? If you're just doing robotically your job, it doesn't take much mind, right? But the mind gets drained by focusing on what they're not saying, what their body language is, right? The in-between stories, or just figure out a way to communicate with them so that they understand and they can bring it back home to their loved ones, right? So it's a lot of work, right? It's a lot of thinking. So that's one of the things that I tell them. The chit chat, the sunny, the beautiful weather, the fluff conversation that I talk about is in the hallway. Once you enter the operatory room, let's talk about the real stuff, right? Because now you're in a more private setting. But the beautiful weather, we sometimes talk about it too long. It's like, it's enough. Let's talk about the business once you get into the chair. Then you look at the body language. Somebody who's a dentalist, top and bottom, comes into your room, comes into an operatory room. Do they sit like somebody who's never had a cavity? No. They're just standing there and they're just looking at you, and they don't want to sit on that chair because that chair extracted all their teeth not that long ago, right? So then you tell them to sit. Do they sit all the way or do they sit on the edge? Have you looked at the patient sit on that chair? And when I talk to auxiliaries, they all tell me, oh yeah, that's right. They do stand around and they do sit on the edge of the chair and they don't want the bib on right away. All that is happening in front of you, but you ignore it. So let's stop ignoring that and let's start talking about, I see that you're a little bit anxious today. What's going on? Talk to me. And let them tell you, well, I don't like that chair. Well, why don't you like that chair? Don't just say, oh, it's okay. Everything will be fine. No, I call it the oh no syndrome. It's not an oh no syndrome. Let's deal with it, right? Why is that chair frightening you? Well, last time I was on that chair, they took out all my teeth. Well, what happened when they took out all the teeth? So keep asking the questions, opening it up so that you understand what is their fear before you even start talking about implant dentistry. What do? We bring out models, we bring out things, we talk to them about implant dentistry, and all they're going to say is, I can't afford it, I don't want this. And they block you out. So I remember the conversation we had was, instead of talking about implants, because they're not ready to listen to that, because all they're thinking is it's expensive, it's surgery, which I had before and I didn't like it, right? I don't want to talk about that. So they block you out. And where do you go? Nowhere. You go back to dentures and you let them go out the door with more bone loss, right? So why don't we start with, you've had a denture for a long time. You've had this denture for a denture treatment in your mouth for the past 20 years, let's say. Some things are going well for that. You obviously like it because you repeat, and that's wonderful. If we have to redo your denture, that is a key question. Let us know what you like about it so that we can repeat it. And when you ask that question to a patient, they look at you like you're crazy. What do you mean? I'm here to complain about it. I don't want to hear about complaints. I want to hear about what you like. Do you like the position of the teeth? Do you like the color of the teeth? Talk to me about it. And they start telling you, I love my smile. Great. What do you like about that smile? Start writing notes, right? Do you like the color of your teeth? Oh, I love the color of the teeth. Fantastic, right? Even if it's pearly white, the one that you would never have, but they love it. It belongs to them, right? Write their story, right? What else do you like about it? Well, you know what? When they break, I come here and you fix it fast. Great. What else do you like about it? Keep drilling that question until there's no more answers. Wonderful. Great. Now, when we're going to redo your denture, what is it that you don't want to live with anymore? Don't say what you don't like about it. Don't say negative, like just ask them in a very positive way. And so by starting a positive question, they're now opening up, right? Because it's not negative. They're not like, are they selling me implants? Nope, we're just talking about the denture. We're not talking about implants, right? So now they're going to go into what they never want to repeat, what they're not enjoying about their denture. So what would it be? Some of the things were the glue, like we talked about, right? So, I don't like that glue that I have to put on. Okay, well, talk to me about that glue. What don't you like about, it's that taste in the back of my throat, right? And I have to put again, many times a day because it dissolves in the back of my throat. Okay, what else, right? I don't like, is there sores? I mean, they're just going to continue giving you that list. And if you prudently write what they like on a list, and right next to it, you write everything that they don't like, you're going to see that list of not like is huge. It's long, and I could go on and on and on, right? And you dig, and you dig, and you dig. You dig about the sores. Well, when you have a sore, what do you do about it? Well, I can't wear my denture. Well, how do you go to work without your denture, right? And you just keep digging. And then from there, now you've listened to the patient. You've gained some respect. And you look at them and you say, Mrs. Smith, I'm listening to all the stuff that you like and the stuff that you don't like about your denture. And there's a solution to eliminate all the things you don't like. And they're going to say, well, what is it? And you're going to say, well, implants is your solution. And thank you for giving me all this information. With implants, we can eliminate this. So how do I create the elimination of those things? Just take everything that they didn't like about their denture and transfer it into it disappearing. No more sores, no more glue, no more movement, no more all of those things. It's their list. It belongs to them. Just transfer it into positive. And then talk about the merits of the long term of implants, which is no more bone resorption and all that stuff, right? So now you're having a different conversation with your patient that brings them to another level of understanding. And not only that, you're not talking scientific words like a lot of dentists do, unfortunately. And now they go home and they could logically speak to the one who's going to spend or invest that treatment with them and say, you know what, when I complain about those, bumps that I have in my mouth, I'm not going to have that anymore. And remember, I have to buy that glue that I don't like. I don't have to buy that anymore. Now it makes sense. There's a story behind it that gets everybody excited to invest in that treatment.
Yeah.
Right?
Such a great story.
A
great story. So I know you have tons of other stories, right? That are like this, very similar, very like, if I'm sitting here, it's very refreshing if I'm a dental assistant or dental professional to hear stories like this, because we have to stay engaged in what we're doing. And in order to do that consistently day in and day out, you have to look at the way that you're managing and dealing with processes, procedures, and communication between not only employees within the practice, but also people, patients.
Mhm.
So incredible. So I think about everything that you've been doing over the last 45 years, right? And the fact now that you're ready to retire in a sense from corporate dentistry, not retiring, but
Mm-mm.
retiring from corporate dentistry.
Mhm.
And you have some passion projects and some things that you're ready to kind of start creating and diving into. So I kind of want to transition the show now and kind of have you talk about what's next for you.
Mhm. 2.0 is coming. 2.0, I call it. And that's writing a book.
Wow.
Yes. Yes. Yeah, I'm going to give you a little sample of the title. I'm not going to give it all, but it's empowering the team. And it's taking my 45 years of amazing stories, amazing path in learning on how to develop a proper discussion, a chit chat with your patient, and putting it into a book on how to do my pros and cons. A little sample that I gave you today, but you can go deeper, right? And how to develop a great way to have a conversation with a patient in order for them to say yes and own that yes.
Mm-hmm. So what are some of the different topics and subjects that you're going to be diving into in the book?
Well, I'm diving into learning, and it's things that we do every day, right? Pros and cons of bridges, pros and cons of partials, pros and cons of dentures. How do we take that and bring them into and persuade the patient to go towards saying yes to implants? It's what I'm seeing in the offices is a systematic of here's a model, here's a video, here's a flip chart, and we think they're going to get a yes from a patient. Sometimes we do because they trust us, but a lot of times, more than often, it's a no, or I'm going to think about it. And so how do we take, and a lot of times it's the dentist trying to sell the case to the patient, which is not the way it's supposed to be. The auxiliaries are the ones that should plant the seed. How many times, and I know that if I had assistants in this room, they would tell me, is how many times a dentist will explain his procedure. They leave the room, and then this first minute they leave the room, the patient turns towards the assistant and says, "What was that? I didn't understand a word." Right? Or can you explain to me more? Or should I do this treatment? Or what do you recommend? Would it be the right thing for me? The assistant or the hygienist, whoever it is an auxiliary, or, Jenna in the hallway, who they've known for 20 years, they might bump into and say, should I do this? And very often it's the auxiliary that's going to lame it down. And I'm not dumbing patients, but just figure out ways to talk to patients that will guide them towards the right treatment. And so that book is all about this, is how do we take what we know scientifically, what we know about implant dentistry, what we've learned from dentists, and bringing it to the patient in a way where it makes them feel good about saying yes to the treatment.
Mm-hmm.
Yeah.
Absolutely.
Yeah.
That's incredible. So you have a book that you're going to
Yep.
start writing,
Mm-hmm.
right? And you want to have this book done. That's, I guess, going to be kind of the platform for your, your second 2.0
Yep.
venture. So it's real exciting to think that somebody with 45 years of experience in the dental industry and somebody that has all these incredible stories is going to be able to put everything into a book and to be able to showcase that. So I'm guessing that the book is probably like the foundation for your second coming. What, in addition to writing a book on your past experiences, are you looking to do, or what are you hoping that the book is going to kind of help lead to in the future?
Mm-hmm. I believe it's going to open an avenue of public speaking. I'm already approaching some different organizations where I'm going to be speaking on case acceptance. That is my passion, so that's what I want to stick to. Maybe different dental associations also, and to dentists, right? I'd like to make them understand that referring or doing, let's say, 2 fixed full arches or 2 overdentures a month, they could quadruple, they could do so much more by just changing their verbiage and talking to patients in a different way. So their ROI can be huge if they just tweak, just talk to the person and not to the patient.
What would you say are some of the biggest changes you've seen in dentistry in 2025 compared to, say, the early 2000s?
Guided digital CBCTs. We didn't have that. We used to, do implants with a model and a pen and flap and see what's there, right? So, which taught us a lot, but so much better for the patient to know ahead of time and guided surgery is so quickly. I mean, I spoke about so many of my mentors. One of them is Dr. Robert Stanley, and Dr. Silverman, who teach guided surgery all day long and are so good at it. So if you want to speed up not only the uptime, but also healing time of the patient to do an in and out surgery within, half an hour, everything is done, guided surgery is the right way to go at it, right? So that is what really evolved a lot in implant dentistry for sure.
That's awesome.
Yeah.
So when it comes to connecting with people and consulting, I know you said you live in Canada. Is this something you're looking to do in Canada or Canada and the United States? Like what's your vision?
I'm open to it all, whether it's Canada or the US. I think my focus is going to be more US. There's the corporate world that I'm loving, the DSO section of the US that I've worked with for over 10 years now, and that I feel there's a lot of development that we can do within those organizations to bring implant dentistry to another level and expose more patients to what's available to them. So I'd love to get involved in that and help them get their implant dentistry where it should be.
So if you could go back in time and you could tell your younger self, what would you say would be 3 pieces of advice for a young Vavi who is starting out as a dental assistant? What would you say?
I would say invest more in courses. I know that I was a lot in courses, but I would invest as a dental assistant. I was fortunate as a career person in the medical device system to be able to be exposed to those courses. But as a dental assistant, I didn't see that. And so I would invest more in my career to go to the next level and to be able to build that career for the future. That's one thing I would have done. Secondly, I would have maybe taught dental assisting. It's something that I've always wanted to do. I'm doing it differently. Yeah. I'm doing it at a different angle, but it's something that I've always wanted to do is teach dental assisting school, something that I'm doing on a different level, which is fun right now. Third thing is, what would I have done? I think just travel more. Not even career-wise, it's just travel more.
Which kind of leads me to my next point. We've been sitting here for 40 minutes talking about dentistry, your incredible career.
Yeah.
I'm sure there's a lot of things that you enjoy doing when you're not working. So when Vavi is outside of dental, what are some of the things that you enjoy doing on the personal side? What's your personal life look like?
Well, it's when I was younger, I did play piano. And I quit when I was 17, like a lot of people do. Piano, who wants to do that, right? And when I was around 50, I was like, I want to go back to piano. So I went back, took an amazing teacher that I have, Catherine, who has taught me for the last 10 years. And now getting involved in the Royal Conservatory exams and getting my degree, if we want to call it, in piano, but it's just a joy to do it. It's a beautiful pastime and something that I do for myself.
Gotcha. That's
awesome. Love to swim, love to weight train, something that I'm learning more and more today. and just started mountain biking, which is something I never thought I would do. But
in an area where there's mountains?
I live in an area that mountains, but I do it when I go to Aruba, which is interesting. They don't have that many mountains, but we do it's called mountain biking, but we do it a lot on rocks. And the intimidating thing is there's cacti all over you, all around you. So you got to watch that. But the views are extraordinary. The challenges are huge. And it's just, you're in the sun and ocean splashing not far from you and just enjoying the view. And it's a beautiful sport.
What's your favorite vacation spot?
Right now it's Aruba. Right now it's home away from home. It's a beautiful island. They call it the Happy Island.
Okay. I've never been.
It's safe. It's there's a side that is, it's an island surrounded by water, but there's a beachy side. And then there's just a rough side that's never been touched, where we do our mountain biking. That is absolutely raw and stunning.
That's great.
Yeah.
Well, look, I am so excited that I was able to sit down with you.
Thank you.
I'm so happy that God put you into my life.
Yeah,
and I think it was for a reason. You always mean a lot to me in the short amount of time that I've known you, but I'm very appreciative of you.
Thank you.
And everything that you've done, not just for me, but for the dental industry as a whole. I think you're a great person.
Thank you.
And I think you have so much to offer. So last question for you is this. This is a question I ask all my guests. Mm-hmm. And I'm always curious to see, and the responses are usually very wide.
Ooh, I'm curious.
So I always leave things like this. You've been in the dental industry 45 years. Like, first of all, you don't even look like you're 45. So this is crazy.
I started at year one.
I look at things and I'm like, okay, you're leaving behind a lot of relationships. You're leaving behind, not now, I'm just saying in the end, a lot of relationships, a lot of wisdom and knowledge that you've learned and passed to other people. When you think about how you want to be remembered, when it's all said and done, mm-hmm. What does that look like for you?
Mm. Career-wise, I hope I touched enough people to be able to get these patients off dentures and partials and get them onto the best treatment that there's out there. Bone loss is an issue. It leaves a lot of people dental handicaps, that I call. It leaves a lot of people in nursing homes that are not able to eat, it was my mother. My mother had an upper denture and a lower partial. And for many years, she was having a hard time eating, having a hard time to cope. I lived through it for many years. And I'm hoping to touch enough individuals to turn this thing around. That's one thing. Mm-hmm. The next thing is to just, hopefully I was present enough. Oh, you're going to get me emotional. I was present enough in my family's life because that's what's important at the end of the day, is to be with your family and to enjoy your children and hopefully one day grandchildren, and my partner in my life, and to just enjoy life, enjoy your experience in life, and have no regrets. That's a big one.
Oh, well, if anyone's earned it,
thank you.
You're definitely very deserving.
Thank you.
So, thank you so much for being on the show today. I wish you nothing but the best of luck. I'm definitely going to be keeping in touch with you.
Oh, yeah.
And
you have no choice.
I've got no choice. Thank you so much. And I wish you all the best.
Thank you.
I was down, but now I'm up. Yeah. It's all got